lecture. So today's our topic of PG activity presentation is erythrocyte sedimentation rate and its advances. First, we'll start with what is ESR. So the erythrocyte sedimentation rate, that is ESR, it is a measurement of the sedimentation of the red cell in the diluted blood after standing for 1 hour in an open-ended glass tube of 30 centimeter length mounted vertically on a stand. It's a simple and an inexpensive test, and it is basically the indirect measurement. It gives the indirect measurement of the acute phase response. It's not a diagnostic test, and so it is used as a tool for the in the emergency settings. It is also used to follow up the course in the chronic inflammatory conditions. There are 3 stages of ESR. Stage 1, there's formation of rouleaux, that is lag phase, where the RBC cells aggregate, and it is amounted about 10 minutes. Then there's sinking of the rouleau formation, which is known as decantation phase, which amounts about 40 minutes. And last but not the least is a packing of the rouleau formation, that is 10 minutes. There are 3 main factors which are affecting the ESR. The first is erythrocytes, the second is plasma, and the third are the technical factors and the mechanical factors. Let's start with the erythrocytes. Basically, the RBC and the plasma ratio, it affects the ESR. One thing. Second, the size of the RBC, that is macrocytes tends to sediment rapidly than the microcytes. As well as the shape of the RBC, like in sickle cells and the spherocytes, they are unable to form the rouleaux, so hence it lowers down the ESR. The plasma, it is the most important factor which is affecting the ESR. Whenever there is increase in the plasma protein, it reduces the ZETA potential, which is normally present on the RBC surfaces, and hence the RBC repel each other. But whenever there is increase in protein in the plasma, it reduces that negative charge on the RBC surface, and hence the ZETA potential, and further favor the rouleau formation. So increase in fibrinogen in the acute inflammation condition results in rise in ESR, while immunoglobulin in chronic inflammation contributes to the elevation in the ESR. Some mechanical factors also falsely affect the ESR values. ESR is falsely high when the tube is not vertical, or the timing is long, whenever there is high temperature, or there is vibration. It is falsely low whenever there is air bubble in the tube, or you before 60 minutes you count the value, that is short timing, or you do it on the low temperature. What is the significance? Why we are doing it? It is basically used to differentiate the organic diseases from the functional disorders. It also correlates with the disease activity and helps us in monitoring and response to the therapy. It forms an important criteria in the diagnosis of temporal arthritis and polymyalgia rheumatica. It distinguishes the angina pectoris from the myocardial infarction in the emergency settings, and in chronic inflammatory condition like rheumatoid arthritis, it also distinguishes the iron deficiency anemia from the anemia of chronic disease. There are certain sources of error. If we don't take the proper ratio of blood and anticoagulant, it will affect the ESR results. If we take hemolyzed sample or a clotted blood, or there are air bubbles in the tube, and error can also happen if there because of the sunlight, vibration, if there is small bore size tube or dirty and a wet tube, or if there is delay in performing the test. Certain condition which leads to increase in ESR. Physiological conditions like pregnancy and menstruation, it causes an increase in ESR because in pregnancy it causes hemodilution. So basically the plasma level increases, and so ESR increases. While in pathological conditions like acute and chronic infection, rheumatic fever, rheumatoid arthritis, myocardial infection, nephrosis, acute hepatitis, and tuberculosis, there's increase in acute phase reactants, and ESR is a measurement of acute phase reactants, so hence it increases ESR. Certain condition leading to decrease in ESR. Polycythemia. Here the amount of RBCs are more, so it results in decrease in ESR. Congestive heart failure. It causes toxic damage to the myocytes, so hence it decreases ESR. Hypofibrinogenemia, because as we have studied that fibrinogen, it reduces the ZETA potential, so hence it decreases in ESR. And if there is a spherocyte and sickle cell, it enables to form the rouleaux formation, and so it results in decrease in ESR. Now we will discuss certain methods for the estimation of ESR. Manual methods like WINTROBE, WESTERGREN'S, ZETA sedimentation ratio, and micro ESR methods. And some are automatic methods like Monitor 100, VESMATIC 60, SEDIMENTATIC, SEDISCAN, and ESR stat. First, let's study the WINTROBE method. WINTROBE is a 110 mm long, narrow, thick wall tube, which is blind-ended on one side with 3 mm internal bore diameter. It is graduated from 0 to 10 centimeter in both the direction, from upward to downwards and from downwards to upward. So the scale marking from above to downward is used for the ESR estimation, while from below to upwards, it is used for the hematocrit, that is packed cell volume determination. How to do it? We have to mix the anticoagulate blood thoroughly, and we have to fill the WINTROBE tube using the Pasteur pipette up to mark 0, and we have to place the tube vertically in the stand and note the ESR value at the end of the 1 hour. Next method is WESTERGREN'S method. Here we use WESTERGREN'S pipette, which is 30 centimeter in length, 2.5 mm in internal diameter. Here the marking on the tube is only up till 20 centimeter. And the anticoagulant used is 3.8% trisodium citrate dihydrate solution, which is diluted with the venous blood in 4:1 proportion. The test has to be carried out within 4 hours of the blood collection if the sample is being kept at the room temperature. Here's the comparison between the WINTROBE tube and the WESTERGREN'S pipette. There's also one modification of WESTERGREN'S method. Here we, instead of using the citrate and as an anticoagulant, we use EDTA. The next method is micro ESR, which is also known as Landau-Adams micro sedimentation method. Here are the requirements. We use the capillary blood from the fingertip, heel or toe, and we attach the Landau pipette and to the suction drain, and we draw the 5 gram per dl sodium citrate solution up to the first line of the stem. And then we draw the blood up to the second line of the stem. Then we mix it and we force them back into the stem and set the upper level to the 0 mark at the top and place the tube vertically on the stem, and we note the ESR. Basically, it is using small amount of samples, so it is preferably used in the pediatric. The next is ZETA sedimentation ratio. The ZETA sedimentation ratio is performed using a small bore capillary tube, and hence it is also preferred in the pediatric population. With the blood, you have to spin it for 3 to 4 minutes, with each cycle prolonging about 45 seconds. 4 cycles has to be done. And the machine in which we centrifuge this is known as ZETAfuge. We centrifuge alternatively. So first the compaction of the RBC happens, and then they disperse, and then again compaction. The tube is then read on the special reader to obtain the ZETA grid. And then the ZETA sedimentation ratio is calculated, which is equal to true hematocrit divided by that ZETA grid value, which we obtain, into 100. It is rapid and it corrects for the anemia and require only a small sample, so it is desirable for pediatric patients. This is a ZETAfuge machine. Next method is VESMATIC 20 instrument. It is basically designed to sample 20 samples at the same time, and the results are very much comparable to the WESTERGREN'S method, and the time taken is also around 20 minutes. This is a diagram of VESMATIC 20. The principle of the method. Basically, we collect the blood in a cuvette and mix it by the instrument. The sample is allowed to stand at the 18-degree slant from vertical. Why? Because it will further accelerate the RBC sedimentation. And the optoelectrical center is used to measure the ESR, and then the data are elaborated and printed. Next method is ESR Stat Plus. It is a centrifugation-based method which provides the result within 5 minutes. This is a machine. The principle of ESR Stat method is we place the sample in the centrifuge, and the infrared laser is used to track the erythrocyte plasma phase and takes the multiple measurements. So the linear portion of sedimentation is that, and using the software, we determine the ESR results. The next method is SEDIMENTATIC. The Phil's WESTERGREN'S pipette is placed into the SEDIMENTATIC automatic ESR reader, which accelerates the sedimentation under condition. The reader displays the result of each sample on LCD after 15 minutes. This is a diagram of SEDIMENT. What are the advantages of all the automatic methods that we have studied? Basically, they are designed to accurately and precisely measure the rate, and it requires less sample. It has the inbuilt printer in it. It provides 5 minutes, and there's no external inflow of sunlight or temperature or filtering of it. And also, it causes reduction in the biomass, which is important.